It's a health change that affects more than 2 million women every year. There's long been a stigma surrounding menopause, but doctors and women are working to make it more mainstream and working to seek new medications to treat symptoms. As Vivian Lee reports, some drugs can be hard to access and aren't covered by insurance.
Susan Neal was the head of HR for a large company when she started having debilitating symptoms.
Brain fogginess, forgetfulness, irritability.
Susan, then a mom to a 5-year-old girl, was in early onset menopause.
So it came very fast, and it actually ended very fast. I was like fully menopausal at 43.
Susan left her job and spent 7 years undiagnosed and untreated for her symptoms. She now sees Dr. Robin Noble, an OBGYN and a certified menopause provider at Intermed.
Hi, how are you?
Dr. Noble says menopause is a time when menstruation ends. Patients enter this phase 12 months after their last period, with the average age being 51. However, symptoms can begin during perimenopause, which can start in the late 30s or even early 40s.
Heightened PMS symptoms, breast tenderness, bloating, changes in their bleeding patterns, mood symptoms, migraines, joint pains, all this whole host of symptoms.
Studies show that many menopausal women aren't getting any treatment and often don't talk about it with their doctors. But Dr. Noble says women don't have to suffer through this phase of life. There are a number of treatment options, including hormone therapy, and there are new drugs on the market to treat symptoms, namely hot flashes, but insurance companies either won't pay for them or make women try and fail with other treatments.
And sometimes they will have to either pay out of pocket or go through those hoops and try various things.
As for Susan, hormone therapy put her on the right track to a healthier life. She speaks publicly and encourages women to advocate for menopause care, especially in the workplace.
Are we covering hormone replacement therapy so it's accessible for people? Because that's the other problem. It's not always very accessible. It's not inexpensive.
Congress is also considering a bill that would boost menopause care as more women are breaking the stigma and speaking openly about symptoms and their impact on their lives.